Hi everyone, welcome back to our channel. Today, we're diving into the results of a new study comparing two of the hottest weight loss drugs on the market, tirzepatide, better known as Zepbound, and semaglutide, known as Wegovy. The big question is, which one comes out on top? By 2030, it's estimated that more than 2.9 billion adults worldwide will be overweight or obese. That's no small number. Treatments for obesity include lifestyle changes, medications, and metabolic surgery, but medications are becoming increasingly important. In fact, the global weight loss drug market is projected to exceed $95 billion by 2030. And when it comes to this market, two companies dominate: Novo Nordisk with semaglutide and Eli Lilly with tirzepatide. Recently, the New England Journal of Medicine published the results of a Zepbound 5 clinical trial titled Tirzepatide as compared with semaglutide for the treatment of obesity. This was a true head-to-head comparison, meaning both drugs, already in clinical use, were tested directly against each other under the same conditions. Think of it as a one-on-one showdown between Zepbound and Wegovy, a very convincing type of study. Let's look at the participants first. The trial enrolled 751 adults with an average age of 44.7 years. About 64.7% were women, and 76.1% were white. Their baseline health stats tell an important story: an average weight of 113 kilograms, an average BMI of 39.4, and an average waist circumference of 118.3 centimeters. On average, participants had been living with obesity for 16 years. These were people with significant obesity, not borderline cases. Even more striking, 50% of them had at least two obesity-related conditions, such as sleep apnea, cardiovascular disease, or high blood pressure. Now for the treatment details. Participants were randomized in a 1-to-1 ratio. In the tirzepatide group, they received a weekly injection, with the maximum tolerated dose being either 10 milligrams or 15 milligrams, and about 89.3% reached the full 15 milligrams dose at least once. In the semaglutide group, weekly injections were given with a maximum tolerated dose of 1.7 milligrams or 2.4 milligrams, with 92.8% reaching the full 2.4 milligrams dose at least once. Both groups also received counseling on diet and physical activity. Treatment lasted 72 weeks, with results measured at the end of that period. So how did they do? The results were striking. By week 72, participants taking tirzepatide lost an average of 20.2% of their body weight, about 22.8 kilograms. In comparison, the semaglutide group lost 13.7% of body weight, about 15 kilograms. That's a difference of 6.5 percentage points, translating into a 47% relative advantage for tirzepatide, p less than 0.001. Put simply, tirzepatide achieved 1.47 times greater weight loss than semaglutide. Oh, put that in perspective. Losing just 5 to 10% of body weight already improves many health markers. Losing 15 to 20% can substantially improve obesity-related diseases. And losing more than 20%, that level of effectiveness is approaching the results of bariatric surgery. Interestingly, the study also found gender differences. Women lost more weight than men, even though men also saw significant reductions. This suggests that future treatments may need to be tailored differently for men and women. Beyond weight, waist circumference also improved dramatically. The tirzepatide group lost an average of 18.4 centimeters compared to 13.0 centimeters with semaglutide. That's a difference of 5.4 centimeters, which is highly significant. Remember, every extra 5 centimeters of waist circumference increases mortality risk by 7% for men and 9% for women. Clinical guidelines recommend reducing waist size by at least 4 centimeters when treating abdominal obesity, so tirzepatide performed exceptionally well here. What about safety? Both groups experienced common side effects such as nausea, constipation, vomiting, and diarrhea. These were mostly mild to moderate and occurred during dose escalation. Injection site reactions were reported in 8.6% of tirzepatide patients, compared to 0.3% with semaglutide, but no serious injection reactions occurred. Rates of serious adverse events were similar, 4.8% for tirzepatide versus 3.5% for semaglutide. 6 participants in each group discontinued treatment due to side effects. Overall, both drugs were considered safe and tolerable, with tirzepatide showing a more favorable benefit-risk ratio. The study also had strengths. It included a diverse population, with 19% African American and 26% Hispanic/Latino participants, representative of the U.S. obesity population. It also tested the maximum tolerated doses, reflecting real-world clinical use. Of course, there were limitations. It was not blinded, so participants knew which drug they were receiving. However, researchers noted that the results were consistent with earlier blinded trials, supporting the reliability of the findings. Mechanistically, here's the key difference. Semaglutide is a single-target drug. It activates the GLP-1 receptor, which suppresses appetite, slows gastric emptying, and enhances satiety. Tirzepatide is a dual agonist, activating both GLP-1 and GIP receptors. GLP-1 reduces appetite and delays gastric emptying, while GIP directly regulates fat metabolism and boosts energy expenditure. In short, tirzepatide works on 2 pathways at once, suppressing appetite and increasing fat burning, which explains its superior weight loss effect. But ultimately, neither drug is universally better. What works best depends on your individual biology, tolerance, and health needs. Choosing between Zepbound and Wegovy should ideally involve consultation with a healthcare provider who can review your medical history, lab results, and personal preferences. Sometimes, doctors may start patients on one drug and switch if side effects or results aren't ideal. Other factors, such as insurance coverage and cost, are also very important for many patients. In summary, obesity management is moving toward more effective and more personalized treatments. We can expect even more innovation in the future, along with efforts to expand access so that more patients can benefit. Let's look forward to more breakthroughs in obesity treatment. If you enjoyed this video, don't forget to give a thumbs up, subscribe, and hit the notification bell. Thanks for watching, and we'll see you next time.